The thyroid gland is a small, butterfly-shaped organ located in the front of the neck. It plays a crucial role in regulating metabolism by producing thyroid hormones, triiodothyronine or T3 and thyroxine or T4. When the thyroid becomes overactive and produces excessive amounts of these hormones, the condition is known as hyperthyroidism. This disorder can significantly impact various bodily functions, leading to a wide range of symptoms and complications if left untreated. This article will explore hyperthyroidism in depth, covering its causes, symptoms, diagnosis, treatment options, and potential complications. Hyperthyroidism is a condition characterized by excessive production of thyroid hormones, leading to an accelerated metabolism. This can cause symptoms such as weight loss, increased heart rate, anxiety, and excessive sweating. The condition affects people of all ages, but is more common in women than men. The severity of hyperthyroidism can vary from mild to severe, and in some cases it can lead to life-threatening complications such as thyroid storm, a medical emergency requiring immediate intervention. Several conditions can cause the thyroid to become overactive. The most common causes include Graves' disease is an autoimmune disorder in which the immune system mistakenly attacks the thyroid gland, causing it to overproduce thyroid hormones. It is the most common cause of hyperthyroidism, accounting for about 80% of cases. Graves' disease often runs in families, suggesting a genetic component. Symptoms specific to Graves' disease include exophthalmos or bulging eyes, which is a characteristic sign of Graves' disease, goiter, which is an enlarged thyroid gland, pretibial myxedema, which is skin thickening, usually on the shins. And this condition occurs when one or more thyroid nodules become overactive and produce excess thyroid hormones independently of the body's regulatory mechanisms. Unlike Graves' disease, toxic nodular goiter does not cause eye symptoms. Thyroiditis refers to inflammation of the thyroid gland, which can lead to temporary hyperthyroidism. Different types of thyroiditis include subacute thyroiditis, often follows a viral infection. Postpartum thyroiditis occurs in some women after childbirth. Silent thyroiditis, a painless inflammation of the thyroid. The thyroid gland uses iodine to produce hormones, but too much iodine can lead to hyperthyroidism. Sources of excess iodine include iodine-rich foods like seaweed, fish, and dairy. Medications containing iodine, such as amiodarone, and contrast dyes used in imaging studies. Some individuals take excessive thyroid hormone supplements, either accidentally or deliberately, leading to hyperthyroidism. This can occur in patients with hyperthyroidism who take levothyroxine in incorrect doses. In rare cases, a tumor in the pituitary gland can lead to increased thyroid-stimulating hormone, or TSH, production, which in turn overstimulates the thyroid gland. Hyperthyroidism affects multiple organ systems, causing a variety of symptoms. These include general symptoms can include unexplained weight loss despite normal or increased appetite, increased sweating and heat intolerance, fatigue and muscle weakness, and frequent bowel movements or diarrhea. Cardiovascular symptoms may present as a rapid or irregular heartbeat, also known as palpitations, high blood pressure, and an increased risk of atrial fibrillation, which can lead to stroke. Neurological symptoms might include anxiety, nervousness and irritability, tremors or shaky hands, and difficulty sleeping, also known as insomnia. Reproductive symptoms can be quite varied. For women, this might mean irregular menstrual cycles. Meanwhile, both men and women might experience a reduced libido. When it comes to Graves' disease, there are some specific eye symptoms to look out for. These can include bulging eyes, also known as exophthalmos. Additionally, you might notice dry, irritated or swollen eyes and even light sensitivity. Diagnosing hyperthyroidism involves a combination of laboratory and imaging tests. Blood tests. Thyroid stimulating hormone, or TSH, is typically low in hyperthyroidism. Free T4 and T3 levels are usually elevated. Thyroid antibodies are used to confirm Graves' disease. Thyroid ultrasound. This test helps detect thyroid nodules or an enlarged thyroid. The radioactive iodine uptake test determines if the thyroid is overactive due to Graves' disease or toxic nodular goiter. MRI or CT scans are used in rare cases where a pituitary tumor is suspected. Treatment options depend on the cause, severity, and patient preferences. The main treatments include anti-thyroid medications include methimazole or MMI, which is most commonly used, and propylthiouracil or PTU, which is used in pregnancy or thyroid storm. These drugs block thyroid hormone production and help restore normal thyroid function. Beta blockers, propranolol, atenolol, or metoprolol. These medications are used to control symptoms such as rapid heart rate, tremors, and anxiety, but they do not treat the underlying disease. Radioactive iodine therapy, or RAI. This treatment involves ingesting radioactive iodine, which selectively destroys thyroid tissue over time. It often leads to permanent hyperthyroidism, requiring lifelong thyroid hormone replacement therapy. Surgery, known as thyroidectomy. This procedure can involve partial or total removal of the thyroid gland. It is recommended for patients with large goiters, thyroid cancer, or those who cannot tolerate other treatments. Lifelong thyroid hormone replacement is required after surgery. If left untreated, hyperthyroidism can lead to serious health problems, including a life-threatening condition with symptoms such as extremely high fever, severe tachycardia or fast heart rate, delirium or coma requires immediate hospitalization and aggressive treatment. Osteoporosis or bone loss is a significant concern. Excess thyroid hormones can cause bone thinning, which increases the risk of fractures. Long-term hyperthyroidism can increase the risk of atrial fibrillation. This irregular heart rhythm can lead to serious conditions like stroke and heart failure. Hyperthyroidism is a complex condition that requires early diagnosis and appropriate treatment to prevent serious complications. Whether caused by Graves' disease, toxic nodular goiter, or excessive iodine intake, managing hyperthyroidism effectively can restore quality of life and prevent long-term damage to vital organs. If you experience symptoms such as unexplained weight loss, rapid heartbeat, or excessive sweating, it's crucial to consult a healthcare professional for evaluation and treatment. With proper medical care, most people with hyperthyroidism can live normal, healthy lives.